so here's our right ventricle. So we know whatever comes out of the right ventricle has to be the pulmonary trunk, right? And, well, it's curved, there it is. Pulmonary trunk, aorta, those should be pretty easy. Our pulmonary, and we have our superior and inferior vena cava, which let's find again in this guy because they're kind of funny. I'd be more likely to ask, the aorta certainly in the pulmonary trunk are fair game because they're big, that's superficial right in the front. Aorta, big, big, big vessel. The pulmonary veins, don't love them on here, but you know, I've seen worse. And let's look at this guy here. There's one of our vena cava, I think. Yeah. So again, that's our superior / anterior vena cava, and there's our inferior.
So where your thumb is pinching, this little area right there, what is?
That's the right
Auricle. Okay, so then that's next to the superior, your finger, that was.
superior vena cava,
Vena cava.
right? It
Okay.
empties into the right atrium.
All right.
So superior vena cava, we can't really see the inferior, I've never marked it on this. We have our pulmonary trunk right off the front of the heart. So that's, you know, it's pretty superficial when you're looking at the front of the heart. So that's kind of an easy one. And then we have our aorta here, which is the biggest thing off of there by far. So those vessels aren't too bad, as long as you especially use your, you know, kind of use your logic for what they're going into and out of, I think is the easiest way with those. And the stuff on the inside should be fairly easy, right? So we have our interventricular septum, interatrial septum. The chambers are easy. We have our tricuspid and bicuspid valve, our right and left atrioventricular valves. Nice little papillary muscle, that bump there with the chordae tendineae. We have our trabeculae carnae, right, our meat tubes. And then the pectinate muscle, see how that kind of looks like a comb? In the atria. If you stick your fingers in here, you can feel the fossa ovalis in between those, so the thinnest part in between there is just really thin in between the two atria. Don't do that unless you have gloves on. Let's see. What else are we going to talk about in here?
So if you were to say like, where's SA node, would you be doing that on a heart
I
model?
would do that on a model or diagram. There's our moderator band, like I said before. What else is on your list that you need to know on here?